Hello everyone, welcome to today's session on inborn errors of lipid metabolism. I am the facilitator, Dr. Mausmi Shankar Adala, working as an assistant professor in the Department of Biochemistry, St. Joseph's College for Women, Autonomous, Visakhapatnam. The contents in inborn errors of lipid metabolism include lysosomal lipid storage disorders, which are further explained as Gaucher's disease, Niemann-Pick disease, Tay-Sachs disease, Krabs disease. Second one, fatty acid oxidation disorders, where we will be having an overview of fatty acid oxidation disorders. Moving on, lipoprotein metabolism disorders, which explains about familial hypercholesterolemia, type 1 hyperlipoproteinemia and abetalipoproteinemia diseases. Lastly, peroxisomal disorders. Under this, we will be explaining about Geiger syndrome, adrenoleukodystrophy. Moving on to the introduction. Inborn errors of lipid metabolism are a group of rare genetic disorders caused by the defects in the enzymes involved in the synthesis, breakdown or transport of lipids. These disorders lead to the accumulation or deficiency of specific lipid molecules, resulting in various clinical symptoms ranging from mild to life-threatening. Inborn errors of lipid metabolism are genetic disorders caused by mutations that affect enzymes, transport proteins, organelles involved in lipid processing. These disorders impact the body's ability to synthesize, degrade or transport fats, leading to abnormal accumulation or deficiency of certain lipid compounds. The disorders can be systemic or organic specific, with symptoms ranging from metabolic crisis in infancy to progressive neurological damage in later life. Moving on to the first category, fatty acid oxidation disorders. It is abbreviated as FAODs. These affect beta oxidation of fatty acids in the mitochondria, a major energy generating pathway, especially during fasting. Examples and enzyme defects include medium chain acyl-CoA dehydrogenase deficiency, MCADD, most common fatty acid oxidation disorder, and the enzyme include MCAD, very long chain acyl-CoA dehydrogenase deficiency, abbreviated as VLCADD, carnitine palmitoyl transferase 1 or 2 deficiency, abbreviated as CPT1 or 2, affects the transport of fatty acids into mitochondria. The primary carnitine deficiency, the symptoms include hypoglycemia without ketosis, lethargy, muscle weakness, liver enlargement, sudden infant death, also called as kids disease in case of undiagnosed cases. And the diagnosis include plasma acyl carnitine profile, urine organic acid analysis, genetic testing, and the treatment include avoid fasting, frequent feeding with high carbohydrate, low fat diet, medium chain triglycerides MCT oil for long chain fatty acid oxidation disorders, carnitine supplementation when there is a deficiency in the patient. Lysosomal lipid storage disorders. These disorders involve accumulation of sphingolipids or glycolipids due to the defects in lysosomal enzymes. There are many major types. Few include Gaucher's disease. The enzyme involved in this disease is beta-glucocerebrosidase. What are the symptoms? Hepatosplenomegaly, bone pain, anemia, neurological symptoms in types 2 and 3. So, the treatment available for Gaucher's disease is enzyme replacement therapy, ERT, substrate reduction therapy. Second one is Niemann-Pick disease, that is type A and B. The enzyme involved in Niemann-Pick disease types A and B is sphingomyelinase. The symptoms of Niemann-Pick disease types A and B are neurodegeneration is seen in type A, whereas hepatosplenomegaly, cherry red macula, no cure and supportive care is expected in type 2. Moving on to the next disease, that is a Tay-Sachs disease. Here the enzyme involved is hexosaminidase A. The symptoms seen in the patients affected with Tay-Sachs disease are rapid neurodegeneration in infancy, cherry red spot on macula, and no hepatosplenomegaly. Coming to the treatment of Tay-Sachs disease, there is no effective treatment as such available, and only supportive care is seen. Krabs disease, here the patients affected with the Krabs disease, there is a deficiency in the enzyme galactocerebrosidase. The symptoms of the Krabs disease seen in the people affected with this are severe demyelination, irritability, muscle stiffness and early death. Treatment available as such for the Krabs disease is bone marrow transplant, and still it is in experimental stage. Coming to the third category, that is the peroxisomal disorders. These disorders impair the metabolism of very long chain fatty acids, which is abbreviated as VLCFAS, and the other lipids. For example, Jewelger syndrome. The Jewelger syndrome is one of the most common diseases that is seen in peroxisomal disorders. Here there is a defect in the peroxisome biogenesis, that is PEX genes, and the symptoms seen in the patients affected with the Jewelger syndrome, which is under the peroxisomal disorder, includes hypotonia, craniofacial abnormalities, seizures, and finally liver dysfunctioning, which is one of the major cause that can even lead to death. VLCFA, that is very long chain fatty acids, accumulation is seen in the tissues because of the peroxisomal disorder, namely Jewelger syndrome. There is no cure absolutely available, and the patient should be kept only on supportive care. Adrenoleukodystrophy, which is mentioned as XALD. The patients affected with this XALD disease or the inborn errors are found to be defect in ABCD1 gene, affecting the very low chain fatty acids transport. So the patient affected with this XALD disease shows the symptoms of adrenal insufficiency, progressive neurological decline, and the treatment of the patients who are suffering with XALD disease include Lorenzo's oil, and it is proved to show very limited effect, and gene therapy, which is cost and also goes on hit and trail method, hematopoietic stem cell transplantation in early stages. Coming to the lipoprotein metabolism disorders, which is also called as hyperlipoproteinemias. These affect lipid transport in the blood due to the defective apolipoproteins or lipoprotein processing enzymes. Examples: familial hypercholesterolemia, defect LDL receptor of ApoB100, and the patients with these symptoms of lipoprotein metabolic disorders further detailed is familial hypercholesterolemia. Patients with this disorder has elevated, that is very high levels of low density lipoproteins, tendon xanthomas, early onset of coronary artery diseases, that is it is related to complete your heart and other related organs, and the treatment for the patients affected with familial hypercholesterolemia includes consuming statins or PCSK9 inhibitors, and most importantly the lifestyle changes. This is much more easy to follow and shows very good results rather than going for medication. Type 1 hyperlipoproteinemia. This is also named as familial LPL deficiency. The patients affected with enzymes with the hyperlipoproteinemia has a deficiency of lipoprotein lipase or ApoC2 deficiency. The symptoms include for the patients suffering with hyperlipoproteinemia are pancreatitis, eruptive xanthomas, lipemia retinalis, and also the treatment for these patients affected with familial LPL deficiency include extremely low fat diet. This should be a major conclusion. Once again I repeat, extremely low fat diet, no effective drug therapy is available as such. Still it is under research. And coming to the next one, that is A-beta lipoproteinemia. So the patient suffering with this A-beta lipoproteinemia has a defect in MTP gene, that is microsomal triglyceride transfer protein, and the symptoms steatorrhea, fat soluble vitamin deficiencies, ataxia, acanthocytosis can be seen. The patients with A-beta lipoproteinemia also particularly exhibit some positive treatment ways to fat soluble vitamin supplementation, and here also a very strict diet on low fats. Coming to the diagnosis and the tools available as such for all the disorders, newborn screening is must for some fatty acid oxidation disorders, especially your SCIDs. Plasma acyl carnitine and amino acid profiling, enzyme assays in cultured fibroblasts or leukocytes, genetic testing, particularly the targeted panels or whole exome sequencing, imaging, that is MRI for CNS, central nervous system symptoms, biopsy, for example liver, skin or muscle in selected cases. General treatment strategies include main important and very effective treatment is dietary management. It should be tailored to the defect. That is, one particular person with a disease, we should have his own diet control plan. Example, low fat, high carbohydrates and other supplementations. Second one is enzyme replacement therapy. It is abbreviated as ERT. And this already, as we have seen, can be used for Gaucher's disease, Fabry's disease and Pompe's disease. Coming to the gene therapy, it is emerging option for the XALD and others, but since as we mentioned it as emerging, still it is under the research and it takes quite a bit of time to get into the normal public. Symptomatic care. So based on that particular symptoms, the person will have the treatment. For example, seizure control, physiotherapy, cardiac monitoring. And finally, prenatal diagnosis. It is possible only through the enzyme assays or genetic testings in high-risk families. Concluding today's session, inborn errors of lipid metabolism are genetically inherited and can severely disrupt energy production and cellular function. Their clinical spectrum is wide, affecting multiple organ systems, especially the nervous system, liver and muscles. Early detection through newborn screening and molecular diagnosis has improved. Outcomes are very significant. With this newborn screening, there are number of people who are having genetic disorders which are being hereditary in particular families are being pushed to some extent, and the children are being saved. So a big appreciation for the science and research that is going particularly in this arena. And finally, while some conditions have targeted treatments, others still rely on supportive care, where the patient will be under constant care monitoring every vitals of his body, emphasizing the need for ongoing research into gene therapies, and advanced metabolic management. Thank you one and all for your support and patient listening.